The best thing you can donate to food bank is money, and the second best is time. Hi guys, I'm Katla. Welcome to my 6th episode. I am currently studying public health in addition to my public health communication channel. I found one of my recent final projects extremely interesting, as it is the intersection of two of my passions within the public health sphere. So for those of you new to my channel, I am a public health communicator. My background is in science communications, specifically for chemistry. However, my passions and education moved into public health and medical science. So today I'm going to be talking about two of my biggest passions, addressing food insecurity and its effect on recovering from infectious disease. So in one of my public health courses, my final project was to do a literature review on anything I wanted. I decided to read about malnourishment and its effect on COVID-19 disease severity. So for this literature review, I have the link down in the description to the specific article, along with the paper that I wrote and other related articles in my Google Drive folder where I keep all the sources I discuss in these videos. One thing we know in medicine is that malnutrition increases the chance of poor health outcomes in anyone experiencing infectious disease. I am not saying that eating healthy will make someone absolutely immune to everything, or you can forego medication and medical intervention just because you're eating a specific food. Definitely far from it. What I am saying is that we need to address food insecurity and improving the quality and quantity of food available to everyone. Overall, improving nutrition within our population will also relieve strain on our medical systems, along with decreasing the costs of medical care. Having available nutrition is one of the very first lines of preventive care that we should be considering. It is something we deal with every day, multiple times per day. We just need to improve this food to reduce the chances of poor health outcomes. Malnutrition is associated with high disease severity in diseases that include viral pneumonia, which is one of the most common complications of COVID-19. In addition to this connection between viral pneumonia, COVID-19, and malnutrition, we also know that COVID-19 causes a lot of symptoms in its early stages that are associated with short-term malnutrition. This includes dyspnea, difficulty to breathe, dysgeusia, which is a metallic or bitter taste. It's associated with loss of taste, anosmia, loss of smell, nausea, vomiting, diarrhea, dysphagia, difficulty to swallow. I actually experienced that personally when I had COVID back nearly a year ago now, and then also anorexia. So one thing I want to mention is that there's a difference between anorexia and anorexia nervosa. Anorexia nervosa is the eating disorder. Anorexia, when just set on its own, is inability to eat. So this is like a severe loss of appetite, or even, this is also something I experienced when I had COVID-19, and it's like you feel hungry, but you just can't bring yourself to eat. You have zero appetite, zero desire to eat at all, and it's rather miserable, and it actually made my recovery very difficult. All those symptoms are associated with weight loss and malnutrition. Additionally, a harsh viral illness like COVID-19 will increase your metabolic rate as your body tries to fight it off, and you have an increased need for calories, but also you're unable to take in more calories. So with COVID-19 specifically, we're considering the severe complications of viral pneumonia because people are malnourished, but also having a variety of symptoms that cause malnourishment in the first place. When the study was completed, demographic details such as age, sex, weight, smoking status, and presence of comorbidities such as hypertension and diabetes were controlled for amongst the patient population. The study was completed in March and April of 2020, so fairly early on in the pandemic. However, we knew at that time that the comorbidities such as hypertension and diabetes had an effect on poor prognosis of COVID-19, and we are able to diagnose specific COVID-19 cases through RT-PCR testing. So overall, this study found that 42% of patients who arrived at the hospital and were admitted for COVID-19 experienced some level of malnutrition. And then 18% of the population who were hospitalized for COVID-19 experienced severe malnutrition. From these populations of the hospitalized patients, 2/3 of these patients who were eventually transferred to the ICU showed some sign of malnutrition, and then 40% of the patients showed severe malnutrition. We have to consider that COVID-19 can cause some level of malnutrition, but when we're looking at the severe malnutrition numbers, such at this 39% of patients transferred to ICU, you have to realize that this takes months of not being fed appropriately to get to the level of severe malnutrition. It is a very interesting correlation and a very heartbreaking correlation to see that how many patients were experiencing malnutrition and declined in their cases. So another interesting thing about this study is that they reviewed the symptoms patients were experiencing throughout their time in the hospital. Even though all these patients were admitted to the hospital with COVID-19, those who were showing severe malnutrition rarely had high fevers. Other research that is currently ongoing in seeing how malnutrition affects a person's thermoregulation and their ability to have fevers as they fight off disease. We know that COVID-19 is significantly more harmful to lower socioeconomic status. That is basically a tenet of public health, in that we know that the lower you are in socioeconomic status, the poorer your health outcomes will most likely be. However, this also suggests that there is an increased spread of COVID-19 through these populations because temperature checks are not enough to catch people who may be ill because they don't experience fever in the same way that someone who is fully nourished and healthy would experience fever. So one thing to remember about this study is that these are only correlations we're talking about, as this was a small sample size. It was 160 patients reviewed. Also, the authors of the study weren't able to control for investigate if someone was experiencing food insecurity or other dietary issues causing malnutrition before these patients were hospitalized or before they experienced a COVID-19 infection. Overall, this research is extremely important to public health because it demonstrates the importance of nutrition in preventing adverse health events for those experiencing COVID-19 infection specifically, but also this can be correlated to other viral illnesses, especially those affecting the lungs. People manage their nutrition on a daily basis as best they can, and maintaining good health through proper nutrition is effective for reducing disease and preventing further strain on the healthcare system during a pandemic. Public health efforts to prevent worse outcomes of COVID-19 infection need to have funding, especially when we're considering ways of addressing food insecurity and reducing malnutrition. We have the Emergency Food Assistance Program and the Commodity Supplemental Food Program in the United States specifically, which will provide assistance to people who are at poverty levels and need food. However, this isn't enough, as we see, every day, as we see food bank lines going miles and miles away, as we see people still going hungry, and unemployment benefits ran out a while ago, and we're just getting financial plans through Congress barely now. Even after the pandemic, these programs need support because infectious disease is always a risk when you are malnourished. Additionally, being malnourished as a child will follow someone throughout their life. It will cause chronic illness later in life. So I figured I'd end this episode on a bit of a helpful note and mention what you can do to help relieve food insecurity. You can always contact your politicians and representatives at every level, going from the city level to the federal level. So in my opinion, the best thing you can donate to a food bank is money, and the second best is time. Additionally, you can contact the food bank directly and see if they have any specific items they want. If you live in a rural area or a smaller town and your local food bank is a small operation, it may be best to contact them directly and see if there are specific food items they want. If you live in a big city and you're dealing with a larger food bank operation, it is best to donate money or your time, but especially money. It feels a bit weird to be like, just give them cash. But the thing is, these food banks can bulk buy their food. They can control for what kind of food they get that will best serve their population. They can control what nutrition happens so they can get the best possible food. They can control for expiration date, and they can control for how much storage space they have in their warehouses, as that tends to be also a limited resource. I guess that's all I have for you today. Good luck to the other students out there who are on the quarter system and about to go into finals week also. I am kind of procrastinating on studying right now by making videos, but I'm talking about my work, so hopefully this counts as studying. And yeah, that's all I have to say. Please like, subscribe, comment below if you have anything you'd like me to discuss. Stay safe, wear a mask, volunteer at or donate to a food bank, and I'll see you later. I really told myself I was only going to be making one episode per week. But we're on episode 6 now, and it's been 2.5 weeks.